Hello, my name is Zion Johnson, and today I will be doing my catheter insertion video for BSN 206. So to begin with, I will gather my supplies and I will knock on my patient's door. Hi, my name is Zion Johnson, and I'm going to be your nurse today. I'm going to be doing your catheter insertion. The doctor is concerned about some urine retention that you've been having, and this will help relieve that retention. So first, I'm going to I'm going to close their door, close their curtain to provide some privacy. I'm going to do hand hygiene. I'm going to ask for their name and date of birth. May I have your first and last name and date of birth, please? I will verify their name and date of birth on their wristband, and then I will lay out my supplies that I'll need. So I'm going to have my catheter kit that's already open due to practicing, but we'll pretend that it's sterile. I'm going to grab my gloves and apply them, and I'm going to do some peri-care for my patient. So first, I'm going to lay my patient flat, have them bend their knees and point their feet outward so that I have a clear path. And I'm going to stand on my dominant hand side. I'm going to take my claw and I'm going to take warm water and non-rinse soap. I'm going to wash from the outside. Wash the closest labia and wipe down the urinary meatus and dispose of my towel. Next, I'm going to take a corner of this towel and I'm going to dab dry the outer labia, dab dry the closer labia, and dab dry the urinary meatus. And dispose of my towels. Next, I will dispose of my gloves. And I will I will set my patient to a proper working height, and I will do hand hygiene. Now, Ms. Jones, this is going to be a sterile process. I request that you please keep your hands and feet still while I insert your catheter. Okay. So, I will open my sterile catheter kit, form this into a bag for disposables. And I will open the first tab upwards, second tab out, third tab out, and the last tab towards myself. I'm going to take my sterile gloves and apply them on the side here. I'm going to take my tabs and open them. So first, I'll take my non-dominant hand and apply my glove to my dominant hand. Okay. I'll take 4 fingers. I'm going to apply this glove to my non-dominant hand. Next, I will take my drape and I will apply it underneath my patient's bottom with the shiny side facing down. I'll move my kit a little bit closer. Remove my catheter and place it on my sterile fill. I'll take my peri area. I'll lay it over my patient. I'm going to take my lubricant and I'll apply it inside of the kit. Dispose. I'll take my iodine sticks. Dispose. Dispose. Okay. I'm going to take my catheter. Into the lubricant. So I'm going to take my sterile hand, my non-dominant hand, and I'm going to open my patient's labia. I'm going to swab one side down, swab the closer side, dispose. I'm going to down the middle and dispose. Next, I'm going to take 2 to 3 inches of my catheter. I'm going to insert some resistance, or I'm going to feel my patient's, I'm going to see my patient's urine coming out, and I'm going to feed another 2 to 3 inches in. Okay. On to move the tap from my sterile semen. On to place. Move on to inflate the balloon. Okay. Going to dispose. And then I'm going to take and a catheter bag. I'm going to clamp at the bifocal point of it to the inside of my patient's leg, giving them some slack. And I'm going to place the catheter bag at the edge, or on the bedside, below the waist. I'm going to take, I'm going to perform more pericare. I'm going to clear and dispose of my catheter kit. And I'm going to make sure to place my patient in a comfortable seated position, and I'll inform them, please do not touch your catheter. It's very sterile, and I want you to make sure that when you're moving with your catheter, keep it below your waist and below your bladder. I'm going to ask, do you have any questions along with the catheter? And if not, then I will document this and let your provider know that your catheter is inserted. Thank you for your time, Ms. Jones.